Whoops, LinkedIn says you're not approved for, oh, I'm live. Hi, everyone. Welcome to my Empowered Wellness on this Sunday in October. I'm super excited to invite my friend, Dr. Katie Deming here in Oregon. She's going to be talking to you. She's got an amazing line of supportive bras and things that she likes to, she's a radiology oncologist. And am I saying that right? I hope so. And she's also a mother and an entrepreneur. So without further ado, I'm going to bring on Katie Deming, Dr. Katie Deming from Oregon. We're going to talk about breast cancer and some awesome ways that we can help support women through this process. There she is.
Hi so much, Gina. Thank you for having me. Yes, I'm a radiation oncologist specializing in breast and gynecologic cancers, and also an entrepreneur with a line of products for women with breast cancer who have sensitive skin. Oh, did that come off? Because my earbuds are not working. I can hear it just through the screen right now. Can you hear me?
Okay. No, the audios got lower. Can't hear you as much.
Okay, let me see. Sorry about that.
Maybe just one.
Oh, there we go. Okay, now it is coming through. Okay, perfect. Yeah, sorry. So I am a radiation oncologist and also an entrepreneur. I have a line of bras called Make Mary for women who have sensitive skin from radiation treatments for breast cancer, or just sensitivities from scars and surgeries that they've had. Yeah.
Cool. So what you've been in this business for a long time, and you were researching ways. What made you decide to help women find the support that they needed to have? Is it hard to find bras for radiation when you're undergoing radiation?
Yeah, so I'll just I never intended to design clothing. I was just a radiation oncologist, and seeing the problem every day of my patients had, when you receive radiation for breast cancer, you develop a sunburn-like reaction over the breast that's being treated. And as a resident in my training, and like most radiation oncologists, I was told by my attendings, who were mostly male, that the skin would be too sensitive to wear bras, and so women should just go braless during radiation and wear like a loose cotton t-shirt. And so I didn't really question that when I was in training, but when I started practicing, which now I've been practicing for 14 years. But when I first started practicing, I recognized that this isn't good advice, actually, having women just go braless and wear a loose cotton t-shirt. For one, women are going to work and doing all their normal activities. It's not really practical to go braless. But then two, actually, the breasts during radiation have a little bit of swelling, and actually it feels better to have light support. So I thought for sure there's got to be bras. Bras for women with breast cancer are covered by insurance. And so I thought for sure there's got to be a bra designed for women receiving radiation that I just didn't know about. And so I went and actually did like a little shopping trip. And I told the salesperson that I had breast cancer and that I was looking for, because I just wanted to know what this whole experience was like. And I didn't want them to know that I was a doctor. I just wanted to understand what my patients would go through if they went to go look for bras. And the experience was horrible. Number one, all the products were like totally wrong for anything my patient needed. They're all designed for post-op. So they're compressive, they're like pulling everything in, they're scratchy, synthetic fabrics. The stitching is irritating against the skin. And they're all, pardon me, but they were all ugly and not something I would ever want to wear. And so I went into the store thinking I was going to find something for my patients. And I left there thinking, oh my gosh, I'm never sending my patients back for that experience, because number one, they didn't have anything that they could wear that would help them during treatment. But then also the things that they would be made to feel like they had to wear were not something that they would make them feel well. And so it just started me down this track of like, nobody is seeing this problem the way that I'm seeing it every day. And so then I just started kind of problem solving, really never intending to design a commercialized product, but really thinking, how could I maybe create something that I could give away to my patients. And because I live in Portland, Oregon, which is an apparel town, so Nike, Columbia, Sportswear, Adidas all have headquarters here, I just started assembling a little team to figure out how I could solve the problem of creating bras that felt great against really sensitive skin, that had no seams that touched the skin, that distributed the support in a way that wouldn't be binding, and that also looked beautiful, so that women could wear something that they want to wear. And yes, it was designed by a doctor to meet all the needs of their sensitive skin during radiation, but it wasn't something that they would feel like, I have to wear this, it's hideous, but this is what I'm supposed to do. So that's where Make Mary really started, is that I just saw this problem and I just started to solve it. And now we do have a line. We have 2 bras that are designed specifically for women with sensitive skin. They were designed for my patients who have breast cancer, but I also have sensitive skin, so I wear these bras every day. Actually, everybody on my team also wears them, just because they're super comfortable, cute, and feel great against your skin. So that's kind of how it all happened, but I really didn't intend to design a line of clothing. It just came out of the natural caring for my patients.
That's so awesome that you actually put yourself into their shoes so that you could see what that experience is like,
Yeah.
because even that part of it is part of it. It's like part of the process of working through the mental part of it as well as the physical, knowing, just that whole thing. I can imagine how hard it is for women to be faced with what they're going through, and then, but to flip that around and have something that feels good and makes them happy. And it's kind of like a hug. When we put a bra on, it's kind of like a hug, the way that this material fits and feels on your skin. So it's really, really important. And
Absolutely.
yeah, I was seeing on your website that a lot of women just prefer to wear your bras even after, like maybe they start using them because of breast cancer, and then after and even doctors use them on a daily basis because of the comfort.
Yeah. I mean, I think people are introduced to us through their cancer experience, or maybe find us through that. But yes, definitely, we have about 30% of our customers are people who are wearing our bras now as their everyday bra after treatment. And though it was designed for this specific need to help women through this specific period in their life, they're designed that, and that was the whole point, is that you didn't want it to feel medical. I wanted them to just be beautiful so that they felt good, and anyone would want to wear them. I wanted it to be something that I would go into a boutique and say, I want to wear this. Like, not, how is this going to fit my needs exactly? It's like, no, this is beautiful. I want to wear it. And so I think that is reflected in our customers coming back. And but you said something in there that I think is really important about what is it like to be going through cancer, and how important is it to think about feeling beautiful and feeling good about yourself. And when women go through breast cancer treatment, there's so much that's changing in their body. They've had surgery, they may feel self-conscious about that, and you feel sick from the treatments that we're putting you through. I think it's so important that we give back some of that, feeling of wellness, like that. It is important to feel beautiful. It is important to put things on your body that feel good, that are made with love, that want you to feel healthy, because there's so much about the experience that can make women feel so much not like themselves, and sick and unwell, and bringing a little bit of that back, that feeling well in your mind and your body is so important, especially when you're going through something like cancer.
Definitely. I know. Yeah. My mom had breast cancer, and I asked her before this interview, if she had any reactions and things. And luckily, she was fortunate she didn't have anything. But is there a good percentage of women that have issues with this sensitivity?
Yeah. So about If you take all women with breast cancer, about 30% of them will have a mastectomy. And if you have a mastectomy, about half of them will need radiation as part of their treatment, and a half will not. But if women have a lumpectomy, which is a smaller surgery that's just taking out the tumor, most of those women have radiation recommended as part of their treatment. So most women do have radiation as part of their overall treatment plan and will develop this rash over the breast. But even women who just have surgery, some of them have irritation from the incisions, like up under the arm where the lymph nodes are sampled, or where their breast incision is. And they find that kind of regular bras can irritate that, either the seams or under the breast, kind of they're more irritated. And so our bras are good for all of those aspects, even though the specific problem that I was solving to at the time was really radiation. I developed them with all of the issues that come up related to breast cancer in terms of, sensitivity from incisions and kind of underwire bothering the breast and that kind of thing.
And I saw that the band doesn't roll, which is so important since it doesn't have underwire.
Yeah, so it's designed as a long line, so that the support is distributed in like a wide band down along the lower portion of the rib cage, so that you don't have this kind of binding and irritation right under the breast. And then it feels more like a nice even distribution rather than something that's cinching kind of around your ribs and under the breast. And one of the tricky things was when you create a band like that, sometimes it can roll. And so we've worked really hard to make sure that the design stays flat and really gives you that nice distributed support.
Yeah, that's awesome. And so your bras are made out of cotton with a mixture of modal and spandex.
Yeah, so it's a mix of Pima cotton, which is like one of the softest cottons found in Peru, and it's mixed with modal. And the particular blend that we use a little bit of spandex in there as well. It's designed so that, number one, it's breathable, so that it's using natural fibers and has great breathability, so that you're not trapping heat or moisture against the skin. And then by mixing the modal and the cotton, you get this very, very soft, kind of buttery feel that actually gets softer with washings. One of the things that women who are going through radiation treatment use a lot of creams on their skin. And so I wanted to make sure the fabric was chosen and kind of blended in a way that it would get softer with washing. And if you just use modal like pills after washing, and actually can get kind of not great if you wash it a bunch of times, but this particular fabric actually does better as you wash it. It gets softer. So that was also a deliberate design.
Awesome. I just thought of something as you were speaking. Do you think this would work for breastfeeding moms?
Oh yeah, absolutely.
Yeah.
So it's funny because the nurses in my clinic, several of them, while they've been nursing, they have used the bras because they're good for that. They're not, of course, they don't detach like a normal nursing bra would, but you can, especially the plunge bra, you can just pull it down. It's a perfect sleeping bra and for nursing mothers. Yeah.
Awesome. Okay, great. Because my sister's expecting, I'm going to be an auntie.
Oh, how exciting. Oh, that's so exciting. When is she due?
In March.
Oh, yay. So fun.
Yeah, so cool. And then another thing I wanted to ask you, there were some that I didn't understand because in the questions and answers on your website, what are expanders?
Is that sure.
Yeah. That I don't know?
Yeah, so women who have reconstruction after a mastectomy, there are different ways that you can do construction, but one of them is with implants. So having either saline or silicone implants put in under the skin. But what's different when you have a mastectomy with reconstruction using an implant, that's different than if you just had breast, like a augmentation where you were just putting the implants under your natural breast, is that the skin is very tight after a mastectomy, and basically the skin is pulled across the chest wall and the pectoralis muscle. And so what happens is that you often need to stretch the skin before you can fit the full size of the implant that a woman would like. So when they do the reconstruction, when they do the mastectomy and the reconstruction, they put something called an expander in place of the implant. And then over time, they keep injecting saline to stretch it out over months. And then once they're fully expanded, then they can have this exchange where they put the permanent implants in. So expanders are this kind of temporary way to stretch the skin to allow a full reconstruction.
Oh, interesting. I didn't know about that before.
So many things, right?
Okay, that's very interesting. And then the other thing I liked is that you have gift cards that include shipping, which are great ideas if you have a loved one that's, that's in need of a bra, like, for any reason. It's a great gift.
Yes. So we have that because a lot of times people want to help, or support a loved one going through treatment, and they're not sure what to buy. And then that maybe they're going to have radiation, so our bras would be appropriate, but then they're not sure what size, what style, and not wanting to ask all that information. So the gift cards are a great way that you could buy that for someone who's going to have either, surgery or radiation as part of their treatment. And it's a nice way that they can pick out what they want, and then we'll help them. We can find out, okay, what treatments are you having? What's the size of your breast currently? Are you having a mastectomy? What's happening, and we can adjust and help them figure out the best product for them. But the gift cards are a wonderful way to offer that gift and then allow us to help your friend or loved one find the best product for their treatment.
That's so great. Oh, another thing that I thought was like, whoa, I didn't even realize is that you can use your insurance, your health insurance, to purchase these bras. This is so wonderful.
Yeah. So bras for women with breast cancer are covered by insurance for sure if you have a mastectomy. If you have a mastectomy, bras are covered. There was a Women's Healthcare Act, I think it was 1998, that basically stated that insurance company needs to cover bras for women who've had mastectomies. And then for women who've had lumpectomies, bras can be covered if you have any asymmetry between the breasts. So really, the coverage for insurance is around the bras are pocketed and can hold a prosthesis. And so if you have any asymmetry, then you can have your doctor write a prescription, and then you can get the bra. And the rationale for the coverage of the bra is really that it can hold this prosthesis. Some women don't wear the prosthesis and they'll just use pads to kind of manage the asymmetry. Bras do come with pads, and you can double them up on one side and that kind of thing. But bras that are pocketed, which ours are, can be covered by insurance, and you just need to get a prescription from your doctor. And then they need to be purchased through an authorized DME provider, which is durable medical equipment. So we can always help people find someone in their area who does that process.
That's wonderful. I really appreciate you taking your time to tell me all about this. I think a lot of women, especially this month being Breast Cancer Awareness Month, learning that you did this was an awareness to me, because it's something that I can give, my loved ones and things, and support them, like you're saying,
Yeah.
This,
yeah. Well, thank you so much. No, I appreciate this opportunity to be able to share with you and help women. My goal is to make sure that every woman knows, that how they feel and being supported through cancer is just as important as the treatment that they get. So every opportunity to share that message is very much appreciated. So I appreciate the opportunity to be here.
I love your positivity, and I love your motto, soft bras for strong women.
Yep. Yeah.
So awesome.
Awesome.
Thank you so much.
And thank you.
Can I just call you Katie, or do I have to say Dr.?
Yes. No. You don't call me doctor. Yeah, Katie. Yeah.
Katie, awesome. I'm so happy we're friends now.
I know, me too. Thank you so much.
Yes. And everyone watching, if you're watching the replay, please go ahead and share this. And I'm going to drop your website, which is shopmakemary.com. Shopmakemary.com. Thanks, everyone. Thank you, Katie. And I
Yes,
have
thank
a
you.
wonderful day.
You too.
Okay.